My name is Patricia Mullinix. I'm a registered nurse and I work here at Eastern State Hospital. It's a psychiatric hospital. I have been working at bedside care, which is direct patient care contact, since I graduated in 1974 was when I started. And I have been a cancer survivor, and I kind of like to take in this video kind of the aspect of what it's like to be a nurse and what it's like to be a survivor and how I can incorporate one with the other. I am a registered nurse with an associate degree in nursing from Eastern Kentucky University over in Richmond, and the bachelor's of science degree came from UK here in Lexington. It actually took me 3 programs and repeating classes in order to take and get through school. It's a challenge. At one point I was told that I wouldn't be a nurse. Obviously 30 some odd years later being in nursing, I did disprove that I could be a nurse. The most interesting part, I feel, of the job is the fact that it's a challenge every day. I think some of the important things that I've learned about the patients is that they're human beings. They've got feelings, they've got family situations. I'm meeting them when they're not at their best. Treat them with kindness, treat them with respect, and do not be afraid to ask how they're doing, how the family's doing. I am a cancer survivor. I had a biopsy done. We knew it was in the right breast. I have a mother and a sister that have both had breast off, and I had chosen to make the decision of having both breasts removed and have implants done, which was done in February of 2007. Because of the type of cancer it was, I ended up having to have 3 times of chemotherapy, and that is all behind me. I decided finally to take and have the genetic testing done. At that time, found out that I was a gene carrier for the cancer, so chose in February of this year to have a hysterectomy and tubes and ovaries removed, just to take and be sure that there was no further potential of having cancer at that point in time. So I am a survivor. So far, health-wise, I've been great. I've had support from the hospital here. I've been in a cancer survivor group, and family and friends and prayer groups have just helped me through the whole thing. I didn't know how to be a patient. I didn't know how to handle it from the emotional side of it. So that was quite an experience, and I think that has taught me a lot about seeing from a patient side what the illness is like. I mean, I'd always looked at it as a professional, but I had not been as involved in such an emotional situation as the actual one that was doing it. And I think that's taught me an awful lot about how to relate better to my patients. The one thing I think I would tell them most is to keep the faith and keep on going.